Good morning, students. Uh, Today's class is on composition of body fluids. I am Dr. Suresh Babu, Professor and Head, Department of Biochemistry. So there are several types of fluids in our body, and as you know, our human body is composed of water itself as major constituent up to 60 to 70%. Likewise, our body fluids are also almost filled with water. So the plasma content of blood tissue and urine that is formed from the renal system are bigger topics and will eventually be covered separately in your future lessons. The other fluids, namely breast milk, cerebrospinal fluid, amniotic fluid, pleural fluid and peritoneal fluid, and aqueous humor, saliva, sweat, tears, semen, and synovial fluid are there. The only important topics will be focused on. As you all know, the breast milk, which builds the bondage between the mother and the newborn. So milk is secreted by mammary glands. It is almost a complete natural food. Milk is the natural food for the newborns of all the mammals. So what is the composition of milk? The major components of milk in different species like humans, cows and buffaloes and goats and goat are different. So as I told before, water is the major constituent with a concentration around 83 to 87%. And the remaining 13 to 17% is made up of solids like carbohydrates, lipids, proteins, minerals and vitamins. And it is an oil in water emulsion. So what is the composition? So here we compare the composition of breast milk from cow, human, buffalo and goat. As I mentioned, water is more than 80% in all species of milk. The calories are dependent upon how much nutrients they provide from carbs, fats and proteins. The human milk is having a higher carbohydrate percentage, that is 6.8 grams percent, and lower protein concentration, that is around 1 gram percent when compared to the animal milk. You can see all kinds of milk are rich in calcium and phosphorus, which are very useful for the bone and teeth development, and B complex vitamins, fat soluble as well as water soluble vitamins. So you can see in this diagram what it is colostrum. The breast milk which is secreted prior to the parturition and after thereafter 5 days to 1 week is called as colostrum. So what is the difference between colostrum and breast milk? So when compared to the future milk, the colostrum is low in fats and carbohydrates, but the need of the hour is met with the high protein content along with the immunoglobulin A, macrophages, lymphocytes, which give instant immunity to the newborn. Carbohydrates in milk. So milk contains lactose, which is a disaccharide also known as milk sugar. So this imparts the sweetness to this breast milk. And also there are lactulose and oligosaccharides, and it has got a high concentration of lactose, 7.5% when compared to the milk of the other species. Thus human milk is very sweet, enough for the babies to relish. So milk sugar serves two major functions. It provides galactose, a structural unit for the growing infant, which is very useful in the brain development. And in the intestine, this lactose gets metabolized to lactic acid, which eliminates the harmful bacteria. So what about the lipids in the milk? So milk lipids are secreted in a unique manner by the lactocytes. They are specialized epithelial cells within the alveoli of the lactating mammary gland. And these fats are dispersed as small globules, as I told, oil in water immersion. So it is mainly composed of triglycerols, phospholipids and essential fatty acids. So there are plenty of medium or short chain and saturated fatty acids like palmitic acid, myristic acid, stearic acid, lauric and butyric acid. Oleic acid is an unsaturated fatty acid which is also present plenty as a lipid in the milk. So this globule diagram you can see which is being secreted, it's a milk fat globule, and you can also see the structure of milk fat globular membrane MFGM in the mammary alveolus. It is a source of multiple bioactive compounds including phospholipids, glycolipids, glycoproteins and carbohydrates that have important functional roles within the brain and the gut. So coming to the proteins in the breast milk. So the major milk proteins are casein, which is about 80%, and lactalbumin and lactoglobulin. So this small concentration of the enzymes protease, lipase, lysozyme and immunoglobulins are also found. Milk casein, which is a phosphoprotein, is almost a complete protein next to egg albumin, containing all the essential amino acids. It is present in the milk in the form of aggregates called micelles. So the white color of the milk is due to the dispersion of the calcium caseinate micelles. You can see in this diagram how these fat globules are dispersed. So on the right side there is an zoomed in diagram. You can see the casein micelles are dispersed among the fat globules. So this is a microscopic diagram of the casein micelles. You can see the submicelles along with the peptide chains and the calcium and phosphorus. So what is whey? Whey protein. If the milk is acidified, in Telugu we call it as paalu virigipodam. So this casein gets precipitated at its isoelectric pH, that is 4.7. And the supernatant clear fluid is called whey protein, whey solution, which contains the proteins, 20% of milk proteins. These include lactalbumin and lactoglobulin and also various enzymes like lipase. So minerals, what are those present? As I already mentioned, calcium, magnesium, phosphorus, which are very essential for the infant growth. They are all present. But it is a poor source of iron and copper. So vitamins in the milk are you can see the inflorescence, that is due to riboflavin, and also other B complex enzymes, and also vitamin A is present in the milk. And not only these vitamins, minerals, carbs, lipids and proteins, but there are also lactobacillus, that is the bacteria that present in the milk. This is what's the purpose? This aids in the growth of the intestinal bacteria, which ultimately gives rise to which breaks down the lactose to lactic acid and production of the acetic acid, which is helpful in killing the harmful bacterial accumulation and also the fungal growth in the intestine of the newborn. Okay, so what is the calorific value of the milk? So human milk provide about 70 calories, whereas buffalo milk it is around 95 calories per 100 ml. So which one you prefer? So it depends upon the age. So as the infant grows, you may be and also in the adult stage we may require more of the buffalo milk. So coming to the other body fluid, that is cerebrospinal fluid, CSF. It is secreted by the choroid plexuses around the cerebral vessels and along the walls of the ventricles of the brain. So it fills the ventricles and cisternae, bathes the spinal cord, and is reabsorbed into the blood through the arachnoid villi. CSF turnover is very rapid, exchanging totally about 4 times daily. So more than 80% of the CSF protein content arises from the plasma by ultrafiltration and a process called pinocytosis. The intrathecal synthesis also occurs, which produces CSF. And we do usually lumbar tap in the lower lumbar areas. So the lowest protein concentration and the smallest proportion of the larger protein molecules are in the ventricular fluid, whereas as the CSF passes down to the lumbar spine where the specimens are usually collected, the protein concentration increases. So what is the function of CSF? Why it should present in the brain? So because brain has no lymphatic system, the CSF acts as its lymphatic system, so which drains into the ventricular system and moves into the space surrounding the brain and the spinal cord, which serves as a shock absorber, and it also helps in the regulation of the intracranial pressure. It is believed that CSF also influences the hunger sensation and eating behaviors. So the diagram shows the procedure called lumbar puncture, also called as the spinal tap. You can see a needle is inserted into the L3 and L4 junction, or L4 or L5. So what is the purpose of the spinal puncture? For the purpose of the laboratory analysis of the CSF. So after spinal tap, okay, after all, why do we want to do the procedure? Because when we know the normal composition of the cerebrospinal fluid, we can also know in various pathological conditions like meningitis how it alters. So if you look at this composition of the CSF, so the volume is around 90 to 150 ml, which is a clear and colorless liquid with a total cell count of 0 to 5 with a pH of 7.3 to 7.4, which is equal to that of blood pH. But the chemical composition is very different. Glucose is lower than the plasma values, but chlorides are higher, little bit higher. So coming to the protein, they are low molecular weight, pre-albumins, albumins predominantly, and also transferins, and also globulins. So the concentration of the protein is very low when compared to the plasma values. In plasma, the total protein values are around 7 grams per deciliter, whereas here in CSF it is 15 to 45 milligrams per deciliter. Please remember that this is in the CSF protein value is in milligrams per deciliter, whereas in plasma it is in grams per deciliter. So what are the indications for this spinal tap? After all, why we should do such a painful procedure? So in CNS infections like meningitis, encephalitis, or head injuries, or in brain tumors, the composition of CSF is altered as shown in this table. So in TB meningitis, what happens? The normal CSF will become opaque, yellowish in gross appearance, and the cell count is increased, protein content is increased, but the glucose is on lower side because the bacteria consumes this glucose, which makes it up to less than 20 milligrams per deciliter. Whereas in bacterial meningitis, the glucose is almost undetectable. It will go up to the 0 also. But you remember that in viral meningitis, the glucose value is almost normal. Okay, but what about in head injuries? In subarachnoid hemorrhages, so the color and appearance is slightly blood tinged, whereas if you see under the microscope, then you can see various RBCs and white blood cells, whereas the proteins are usually increased in such as any stressful condition, the proteins are increased, whereas glucose levels are normal because this is not an infection. So what is the clinical significance of the protein and chloride levels in the CSF? So we can divide this aspect into 3 parts, that is increased in capillary permeability, how In infections like meningitis, encephalitis, polyneuritis and trauma, the capillary permeability is increased so that more protein is detectable in CSF. And in mechanical obstructions, which is created by the spinal cord tumors, also in acoustic neuromas, meningiomas, you can find very high values of the protein up to 2 grams per deciliter. And also in the beginning I have already told you there is also intrathecal synthesis of the protein in conditions such as demyelinating diseases of the CNS, where axons are infiltrated by the B lymphocytes which secrete the immunoglobulins. So in multiple myeloma, multiple sclerosis and also in neurosyphilis, you can find higher gamma globulins. What are these gamma globulins? They are nothing but immunoglobulins. So in TB meningitis and also in brain abscess, you can find increased protein concentrations. So how do you estimate these proteins in CSF? So estimation is by turbidometry method, and Pandis test is done for globulins. So chlorides usually decrease in meningitis to 102 to 120 milliequivalents per liter, and whereas it is very quite low in TB meningitis. What about the lactate levels? Less than 2.1 millimoles per liter is normal, whereas in bacterial and TB meningitis it is more than 3.5 millimoles per liter, whereas in viral meningitis the lactate levels are as usual normal. So coming to alpha-2 macroglobulin, AMG, otherwise called AMG, what is the biochemical significance? If the partial or complete breakdown of the blood-brain barrier occurs, as in meningitis or bleeding into the subdural space, the AMG concentrations in CSF are increased. So this AMG estimation may be helpful in differential diagnosis of the neurological disorders of elevated CSF protein. So CSF concentrations normally of alpha-2 macroglobulin normally increase with age, suggesting that partial but progressive breakdown of the blood CSF barrier occurs with aging. So this diagram shows the electrophoresis. This is a high resolution electrophoresis of the CSF proteins. So the normal and abnormal CSF pattern in the electrophoresis. So it has got two striking features, a prealbumin band and the two transferrin bands, that is beta 2 and the beta 1 position. So both beta 2 transferrin and other relatively abundant CSF protein, that is prostaglandin D synthase or beta trace, have been used to determine whether clear fluids from nasal or ear passages represent leakage of CSF, so-called CSF rhinorrhea and otorrhea. That means if there is a head injury, if the CSF is leaking from the nose or leaking through the ears, if you collect that fluid and if you run the electrophoresis, then it will, if it shows the two transferrin bands in the beta 1 and beta 2 position as shown on the right side of the slide, so you can conclude, you can come to a conclusion that there is a CSF leakage, because in CSF only this beta 1 and beta 2 bands are seen. And also there is apolipoprotein E, which serves as one of the major lipid transport protein because of the relative lack of other lipoproteins such as HDL and LDL to carry the lipids. So this is the high resolution protein electrophoresis of CSF. Also what we do in multiple sclerosis, here the CSF appearance clear, leukocytes normal, total proteins also normal, glucose also normal. But what is abnormal? Here in the arrow mark is showing the oligoclonal banding, which is seen around 90% of the cases, and also there is elevated Ig ratio in 90% of the cases. So that is how CSF analysis is very useful, and if you know the CSF composition, then you can differentiate between the normal and the abnormal CSF, and you can come to a conclusion of the diagnosis, and it will be easy for the clinician to treat accordingly. Coming to the next body fluid, that is amniotic fluid. Everybody knows what is amniotic fluid because the fetus lives within the fluid filled compartment. This fluid provides a medium for the fetus to move around freely, so it acts like a cushion against the possible injury, and it also helps to maintain a constant temperature for the fetus, which creates a comfortable heat regulated environment in the uterus. So what we do with this amniotic fluid? So amniocentesis means aspiration of the amniotic fluid from the uterus. So amniocentesis is the term used for the process by which the amniotic fluid is collected for the analysis. So you can clearly see in the diagram, this is done under the ultrasound monitoring. So the volume of amniotic fluid increases progressively until 34 weeks of gestation, which may be around 2 liters of volume, but it gradually declines from the 40th week. So it will come to 1.4 liters then till 42nd week. And what is the other contribution factor for the volume? It is the fetal urination and also the fetal swallowing. So this bidirectional water exchanges and intramembranous flux creates a dynamic equilibrium in the volume of the amniotic fluid. The fetal tracheobronchial tree is filled with this amniotic fluid because obviously the fetus breathes in the fluid. So the fetal breathing of this amniotic fluid is the mechanism of surfactant transport from the fetal lungs into the amniotic fluid. So that is what we take advantage of in the amniocentesis. So composition of amniotic fluid. As the fetus grows, most notably, the sodium concentration and osmolality decreases, and the concentration of the urea and creatine and uric acid increase. And phospholipids are the major lipids here. And you can also find various steroid and protein hormones like 17-hydroxy progesterone, which is helpful in the diagnosis of the congenital renal hyperplasia, and also the thyroid stimulating hormone and thyroxine hormone, which is helpful in the diagnosis of the congenital hypothyroidism. And the prostaglandins are also seen like E1 and E2, F1 alpha and F2 alpha, which increases gradually. So by 16th week of gestation, large numbers of cells are present, having been shed from the surfaces of the amnion, skin, fetal skin and tracheobronchial tree. So these cells have proved to be of great utility in antenatal diagnosis. The scalp hair and lanugo. Lanugo means fine hair on the body of the fetus. These are also shed into the fluid and contribute to its turbidity. And what about the surfactant particles in the lungs, which are termed lamellar bodies? They greatly increase the haziness of the amniotic fluid. So at full term, the amniotic fluid contains gross particles of vernix gaseosa, the oily substance composed of sebum and desquamated epithelial cells covering the fetal skin. So whenever there is the increased fetal stress, the fetal meconium, that is the fetal stool, is also passed, which contaminate the amniotic fluid. So this contains heterogeneous material, and many bipigments can be seen. Therefore, stains on the amniotic fluid are green. The meconium stained amniotic fluid is a sign of fetal stress. So this is a very big explanatory slide regarding the fetal lung maturity, FLM. So the major surface active component of the lung surfactant is palmitate disaturated phosphatidyl choline. otherwise called DSPC. So which represents the 85% of the total lecithins. So the surfactant is a type of lecithin. What is that lecithin? It is a palmitate, or you can call it as dipalmitate phosphatidylcholine. So most of the DSPC in amniotic fluid comes from the fetal lungs via the tracheal effluent. So the concentration of the DSPC here in the fluid is measured directly and is correlated with the fetal lung maturity, or its concentration is related to the another lipid which is called sphingomyelin, which you come across in your lipid classes, and that ratio is used to predict the lung maturity. So nearly all the sphingomyelin in amniotic fluid is derived from non-lung sources. Thus it has no role in the surfactant system of the lungs. That is why we compare our DSPC with the sphingomyelin. So the concentration of the lecithin is relative to the sphingomyelin, that is the LS ratio tends to rise with increasing gestational age. So sudden increase occurs from 34 to 36 weeks of gestation and correlates with the development of the fetal lung maturity. So if the value or LS ratio is of 2.1, it indicates lung maturity. But if the LS ratio is less than 1.2, then it is better to delay the induced labor or delivery until the lung has become more mature. So see, that is the advantage of the knowing the different compositions of the body fluids. So what about alpha-fetoprotein and acetylcholinesterase in amniotic fluid? So the measurement of this AFP increased levels. So what is normal level? 15 to 40 micrograms per ml, and at 40th week it is less than 1 microgram per ml. So these are associated with the neural tube defects, fetal distress, Turner's syndrome. Whereas if elevated alpha-fetoproteins are found, so they can also indicate the intrauterine death of the fetus. So acetylcholinesterase is an enzyme, it is used in combination with amniotic fluid AFP, can aid in the detection of the open neural tube defects from 13th to 25th weeks of pregnancy. So normal amniotic fluid contains a group of non-specific cholinesterase referred to as a pseudocholinesterase enzymes. So CSF contains high concentration of the neural enzyme acetylcholinesterase, and in cases of fetal open neural tube defects, usually 80% of the cases of the defects are in the abdominal wall. So the fluid leaks from the open lesion, allowing the acetylcholinesterase to enter the amniotic fluid. So that is how we can detect these acetylcholinesterase in amniotic fluid. And amniotic fluid bilirubin for intrauterine death risk. So the assessment of the hemolytic diseases, estimation of the bilirubin in amniotic fluid is useful to evaluate the severity of the hemolytic disease. So the concentration of the bilirubin in amniotic fluid is generally too low. So it is usually around 0.01 to 0.03 milligrams per deciliter to be measured by the standard photometric techniques. It is possible, however, to rapidly, accurately and directly measure this amniotic bilirubin by absorption spectrometry at the maximal absorbance of bilirubin, that is 450 nanometer. That is why it is called delta A, that is A means absorbance at 450 nanometers. So prenatal screening, that is chromosomal gene mutation analysis of the fetal cell DNA from amniotic fluid. Here you can see in this diagram, the under ultrasound guidance, a sterile needle is inserted through the abdominal wall into the amniotic sac. A small amount of amniotic fluid is withdrawn through the needle. So this is what is called as amniocentesis. So we take that fluid and we centrifuge the fluid, and the amniotic fluid contains fetal cells which are separated from the amniotic fluid, and they are cultured and the tests are performed on the cultured cells. So we extract the DNA and we do DNA analysis and chromosomal analysis. So what is the use? What's the point of doing all these things? So chromosomal disorders like Down syndrome, metabolic disorders like cystic fibrosis, and sex-linked disorders like hemophilia, and enzyme defects like Tay-Sachs disease can be diagnosed prenatally, so that patient can be given the option of the medical termination of pregnancy or the continuation of the pregnancy, which is strictly under the medical regulations purview. Coming to the pleural fluid is very minimal, which is present in between the visceral and the parietal pleura, unless until there is some injury to the thorax, or if there is infection in the pleura or in the lung parenchyma, the pleural fluid will accumulate from minimal to moderate to the gross levels, even up to the 2 liters levels. So the pleural fluid can be transdate or exdate based on its protein composition. So if the ratio of the protein content between the pleural fluid and plasma is less than 0.5, it is a transdate. If the ratio is more than 0.5, the pleural fluid is exdate. So transdate fluid is like with specific gravity of less than 1.015. It will not clot and it is not associated with inflammation. It is just an accumulation of the fluid within the pleural space. The transdation is observed in nephrotic syndrome due to low osmotic pressure of the plasma and congestive cardiac failure due to increased hydrostatic pressure. Exudate is viscous in nature with specific gravity of more than 1.015. It may not clot and is associated with inflammation or malignancy. So we can find these exudative pleural effusions in tuberculosis, pneumonias, rheumatoid arthritis, and also in lung cancers. So biochemical analysis of exudates is useful in certain disease conditions, like as I told, in these malignancies of the lung and infections of the lung. So estimation of the ADA, that is adenosine deaminase enzyme levels, are useful to guide in cancer, tuberculosis, and rheumatoid arthritis related effusions. So amylase activity also increased in pancreatitis, and rheumatoid factor elevated in rheumatoid arthritis. Carcinoembryonic antigen is increased in malignancy. So all these parameters can be found in the pleural fluid. You can see in this diagram how clear and colorless is the transdate, and how opalescent and yellowish brown of the color of the pleural fluid in the exudate conditions. So just by gross appearance and macroscopic findings, you can just tell whether it is transdate or exudate. But to confirm whether it is transdate or exudate, you need to do the specific gravity test and the total protein estimations and also the ADA levels. Coming to the ascitic or peritoneal fluid, you can see the procedure in the diagram. And normally the triglycerides, proteins, glucose, amylase, and alkaline phosphatase are estimated in ascitic fluids. So what about the albumins? So albumins in ascitic fluid. So we have one particular parameter called serum albumin acetylsalbumin gradient, that is called SAG, SAAG. So we determine the serum albumin levels as well as the ascitic fluid albumin levels in the laboratory, and we subtract the values. If the value is more than 1.1, then it is high albumin gradient. That means serum value is higher than the ascitic albumin value. So in which conditions we can confirm that it can be due to cirrhosis of liver or congestive cardiac failure, constrictive pericarditis, Budd-Chiari syndrome, massive liver metastasis. But what if the low albumin gradient is present? That means there is a little difference between the acidic fluid albumin and serum albumin. So in the conditions such as tuberculous peritonitis and peritoneal spread of the carcinomas in metastatic disease of the peritoneum, and biliary peritonitis, pancreatic ascites, nephrotic syndrome, and pseudocytoma. So it is basically the SAG value is to help the clinician to know whether it is the ascites is due to increased portal hypertension or not. There is also accumulation of the milky fluid, that is chylous ascites or chylothorax. So you can see in the diagram the milky color fluid aspirated from the chylous ascites. So what are those conditions where you can see such a milky fluid, which is lymph, that is in lymphomas, tuberculosis abdomen, or TB thorax in filariasis, and if there is a injury in the lymphatic system. So ascitic fluid characteristics in chylous ascites, you can see the triglyceride levels, especially you can see the triglyceride levels more than 200 milligrams per deciliter. It should be, then only you call it as chylous effusion, or else it would be just a pus. Just wait. Then coming to saliva. Saliva has a very different protein composition compared with the plasma, with amylase and small peptide components representing the major components. So a variety of diagnostic applications can be done by salivary protein analysis. The protein composition can vary with the site and method of the sampling of the saliva. For example, in Sjogren's syndrome with lymphoid infiltration of the salivary glands, there is a dry mouth. So here beta-2 microglobulin concentrations can rise in the saliva. The saliva is tested for secretory immunoglobulin A in infantile hypogammaglobulinemias, and various tumor markers like cytokeratins are being estimated in small cell cancers of the oral cavities. Coming to the last one, that is aqueous humor. It is a fluid that fills the anterior chamber of the eye. This fluid is responsible for maintaining the intraocular tension. The aqueous humor is secreted by the ciliary body, enters the anterior chamber. So in anatomy you will know better about this one. The blockade in the flow of the aqueous humor causes glaucoma due to the increased intraocular pressure. So what is that condition called? Glaucoma, which is the increasing the intraocular pressure, IOP. Thank you very much.